Question 1. Governance review demonstrates that a neuropsychologist is providing ongoing assessment and support to a client diagnosed with a progressive neurodegenerative disease, such as Alzheimer's. The client's family has expressed increasing concern about the client's safety at home, citing instances of wandering and medication mismanagement. The neuropsychologist has observed a significant decline in the client's executive functioning and judgment during recent sessions, impacting their ability to accurately self-report their daily living skills and safety awareness. The family is requesting more direct information about the client's functional status and recommendations for care. But the client, while showing some awareness of their difficulties, is resistant to involving family in these specific discussions, citing a desire for privacy. What is the most ethically and legally sound course of action for the neuropsychologist? Option A. Advise the client to cease all contact with their family to prevent further distress and potential breaches of privacy, and continue to manage their care independently without involving any external support systems. Option B. Conduct a comprehensive assessment of the client's current capacity to understand their situation and make decisions regarding their care and safety. Engage in open communication with the client about the family's concerns and potential risks. And if capacity is found to be significantly impaired and risk is present, consult with the family and explore collaborative care planning while respecting the client's dignity and autonomy as much as possible. Option C. Immediately disclose all observed functional deficits and safety concerns to the client's family without further assessment of the client's capacity or direct communication about the disclosure, as the family's concerns are paramount in ensuring the client's safety. Option D. Continue to provide services to the client but refrain from sharing any information with the family, even if the client's condition deteriorates to a point where they pose a clear and imminent danger to themselves or others, to strictly uphold client confidentiality. Correct answer is B. Conduct a comprehensive assessment of the client's current capacity to understand their situation and make decisions regarding their care and safety. Engage in open communication with the client about the family's concerns and potential risks, and if capacity is found to be significantly impaired and risk is present, consult with the family and explore collaborative care planning while respecting the client's dignity and autonomy as much as possible. Explanation. This scenario presents a professional challenge due to the inherent conflict between a neuropsychologist's duty to maintain client confidentiality and the potential need to disclose information to protect a vulnerable individual. The client's progressive cognitive decline, specifically in the context of a neurodegenerative disease like Alzheimer's, raises concerns about their capacity to make informed decisions and their safety. The neuropsychologist must navigate these competing ethical and legal obligations, balancing the client's autonomy with the responsibility to prevent harm. The correct approach represents best professional practice because it prioritizes a systematic, client-centered, and legally compliant process. It involves a thorough assessment of the client's current capacity, open communication with the client to the extent possible, and consultation with relevant parties, including family or legal guardians, while strictly adhering to privacy regulations. This approach upholds the principles of beneficence and non-maleficence by seeking to protect the client while respecting their dignity and rights. It also aligns with professional ethical codes that mandate responsible disclosure when there is a clear and imminent risk of harm. An incorrect approach that involves immediate, unilateral disclosure to family without assessing capacity or exploring less restrictive options would be professionally unacceptable. This failure would violate the client's right to confidentiality and potentially erode trust in the profession. It bypasses the crucial step of determining if the client can still participate in decisions about their care and safety, thereby undermining their autonomy. Another incorrect approach, such as withholding information from family or caregivers, despite clear evidence of escalating risk and the client's diminished capacity, would be ethically problematic. This failure to act could be seen as a breach of the duty to protect, especially if the client's condition poses a danger to themselves or others. It neglects the principle of beneficence by not taking reasonable steps to mitigate foreseeable harm. A third incorrect approach, such as making assumptions about the client's wishes without direct communication or documented advance directives, is also professionally unsound. This can lead to decisions that do not align with the client's values or preferences, even if made with good intentions. It fails to engage in the necessary process of understanding the client's perspective and ensuring their care reflects their personal goals. The professional decision-making process for similar situations should involve a tiered approach. 1. Assess the client's current cognitive capacity and understanding of their situation. 2. Review relevant legal and ethical guidelines regarding confidentiality and duty to protect. 3. Communicate with the client about concerns and potential next steps, involving them in decision-making as much as possible. 4. If capacity is significantly impaired and risk is present, consult with trusted family members or legal guardians, always prioritizing the client's best interests and privacy. 5. Seek supervision or consultation from colleagues or ethics committees when faced with complex ethical dilemmas. 6. Document all assessments, communications, and decisions thoroughly. Question 2. Stakeholder feedback indicates a need for a comprehensive neuropsychological evaluation assessing attention, memory, language, executive function, and visuospatial skills. The referring physician has emphasized the importance of a timely report, and the client has expressed concerns about prolonged testing sessions due to fatigue. Which of the following approaches best balances the need for thoroughness with practical considerations? Option A. Utilize a single, broad-spectrum neuropsychological test that claims to assess all major cognitive domains, prioritizing completion within a single session to expedite the report. Option B. Select a subset of tests from a well-established neuropsychological battery that are known to be quickest to administer, ensuring coverage of at least 3 core cognitive domains to meet the time constraints. Option C. Administer a battery of individually standardized tests, each targeting a specific cognitive domain, and strategically sequence them to manage client fatigue, with the option to break the assessment into multiple sessions if necessary. Option D. Focus assessment primarily on attention and executive function, as these are often the most impacted domains in common neurological conditions, and defer detailed assessment of language and visuospatial skills, unless significant deficits are immediately apparent. The correct answer is C. Administer a battery of individually standardized tests, each targeting a specific cognitive domain, and strategically sequence them to manage client fatigue, with the option to break the assessment into multiple sessions if necessary. Explanation. This scenario presents a common implementation challenge in neuropsychological assessment, balancing the need for comprehensive cognitive evaluation with the practical constraints of time and client engagement. The professional is tasked with assessing multiple cognitive domains, including attention, memory, language, executive function, and visuospatial skills, which requires careful selection and administration of appropriate tests. The challenge lies in ensuring that the chosen assessment battery is both psychometrically sound and clinically relevant, while also being sensitive to the client's fatigue and potential for performance decline over an extended testing session. The correct approach involves a systematic, domain-specific selection of assessment tools that are known to be reliable and valid for the targeted cognitive functions. This approach prioritizes the integrity of the data by ensuring that each domain is assessed with appropriate instruments, minimizing the risk of practice effects or fatigue-induced errors influencing performance across multiple domains. It aligns with professional standards of practice, which mandate thorough and accurate assessment, and implicitly with ethical guidelines that require competence and due care in the provision of services. By prioritizing domain-specific assessment, the neuropsychologist ensures that the resulting profile of cognitive strengths and weaknesses is a true reflection of the client's abilities, facilitating accurate diagnosis and effective intervention planning. An incorrect approach would be to rely solely on a single, broad-spectrum assessment tool that attempts to cover all domains superficially. This fails to provide the depth of information necessary for a nuanced understanding of each cognitive domain, risks overlooking subtle deficits or overestimating abilities due to the limitations of a generalized measure. This approach could lead to misdiagnosis and inappropriate treatment recommendations, violating the ethical obligation to provide competent and accurate assessments. Another incorrect approach would be to prioritize speed and efficiency by omitting assessment of certain domains deemed less critical by the client or referring party, without a clear clinical justification. This compromises the comprehensiveness of the evaluation and can result in a skewed understanding of the client's cognitive profile, potentially missing significant impairments that impact daily functioning. This violates the ethical principle of beneficence, as it fails to act in the client's best interest by providing a complete picture of their cognitive status. The professional decision-making process in such a situation should involve a thorough review of the referral question and available background information to identify the most critical cognitive domains to assess. This should be followed by a selection of psychometrically sound instruments for each identified domain, considering factors such as the client's age, educational background, cultural factors, and any suspected neurological or psychiatric conditions. The administration plan should be structured to minimize fatigue, potentially by alternating between more demanding and less demanding tasks, or by breaking the assessment into multiple sessions if necessary. Throughout the process, ongoing monitoring of the client's engagement and performance is crucial, with flexibility to adjust the testing schedule or approach as needed. Question 3. During the evaluation of a 65-year-old male presenting with subjective memory complaints, the client explicitly states he only wants to be tested on memory and attention, as he believes these are his only areas of concern and wishes to expedite the process. He expresses disinterest in assessments of executive functions, language, or visuospatial abilities, stating they are not relevant to his perceived problems. What is the most appropriate course of action for the neuropsychologist? Option A. Explain the importance of a comprehensive assessment covering all relevant cognitive and behavioral domains to the client. Discuss the interconnectedness of these domains, and collaboratively develop an assessment plan that addresses the client's primary concerns while also including essential components for a thorough evaluation, documenting the rationale. Option B. Proceed with a limited assessment battery focusing solely on memory and attention, as requested by the client to respect his wishes and expedite the evaluation. Option C. Recommend the client seek a simpler cognitive screening test from a primary care physician, as a full neuropsychological evaluation may not be necessary given his stated preferences. Option D. Immediately inform the client that a comprehensive neuropsychological evaluation is mandatory and that his request cannot be accommodated, proceeding with a full battery regardless of his input. The correct answer is A. Explain the importance of a comprehensive assessment covering all relevant cognitive and behavioral domains to the client. Discuss the interconnectedness of these domains, and collaboratively develop an assessment plan that addresses the client's primary concerns while also including essential components for a thorough evaluation, documenting the rationale. Explanation. This scenario presents a professional challenge due to the need to balance the client's expressed preferences with the neuropsychologist's ethical and professional obligations to provide a comprehensive and accurate assessment. The client's desire to focus solely on specific cognitive domains, potentially influenced by external pressures or a limited understanding of their own needs, necessitates careful navigation. The neuropsychologist must ensure that the assessment is not unduly narrowed, which could lead to misdiagnoses or an incomplete picture of the client's functioning, thereby potentially violating principles of beneficence and non-maleficence. The correct approach represents best professional practice because it prioritizes a thorough and individualized assessment plan that is grounded in established neuropsychological principles and ethical guidelines. This involves a systematic process of gathering information, formulating hypotheses, selecting appropriate measures, and interpreting findings in a comprehensive manner. Adhering to the American Board of Professional Neuropsychology (APN) standards, which emphasize evidence-based practice and a broad understanding of cognitive and behavioral functioning, ensures that the assessment is both scientifically sound and clinically relevant. This approach upholds the principle of providing the highest quality of care by addressing all relevant domains of functioning, even those the client may not initially wish to explore, to ensure a complete and accurate diagnostic picture. An incorrect approach that solely adheres to the client's stated preferences without further exploration or justification would represent a failure to uphold professional standards. This could lead to a superficial assessment that fails to identify underlying or co-occurring conditions, potentially harming the client by delaying appropriate treatment or leading to misdiagnosis. Ethically, this would violate the principle of competence, as it suggests a failure to apply a full range of knowledge and skills. Furthermore, it could be seen as a failure to act in the client's best interest if the narrowed focus prevents the identification of significant issues. Another incorrect approach, that of immediately dismissing the client's preferences and imposing a rigid, predetermined assessment battery without considering the client's input or rationale, would also be professionally unacceptable. This would disregard the client's autonomy and the collaborative nature of the assessment process. Such an approach could alienate the client, leading to a breakdown in the therapeutic alliance and potentially causing distress. It fails to acknowledge that client preferences, while needing careful consideration, are an important part of the assessment context. Professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the client's stated preferences and concerns. Second, educate the client about the rationale behind a comprehensive neuropsychological assessment, explaining how different cognitive and behavioral domains are interconnected, and how a broader evaluation can lead to a more accurate diagnosis and effective treatment plan. Third, collaboratively develop an assessment plan that addresses the client's primary concerns while also incorporating essential domains necessary for a thorough evaluation, explaining the rationale for each component. Fourth, document the client's preferences, the discussion, and the rationale for the final assessment plan. Finally, remain open to adjusting the plan based on emerging findings during the assessment, always prioritizing the client's well-being and the integrity of the professional evaluation. Question 4. Market research demonstrates a growing demand for neuropsychological evaluations in legal contexts to assess an individual's capacity for understanding social cues and navigating complex social interactions. A neuropsychologist is asked to evaluate a defendant accused of a crime where social judgment and interpersonal understanding are central to the allegations. The referral question specifically asks about the defendant's ability to comprehend social nuances and their impact on behavior. Which of the following approaches best aligns with professional standards and ethical guidelines for conducting such an assessment in a forensic setting? Option A. Focus exclusively on assessing general intellectual functioning and memory, as these are considered the foundational cognitive abilities that would indirectly influence social cognition. Option B. Administer a broad battery of neuropsychological tests that includes measures specifically designed to assess theory of mind, emotion recognition, social perception, and executive functions that underpin social cognition, supplemented by structured interviews and collateral information to contextualize findings and assess for response bias. Option C. Rely primarily on self-report questionnaires completed by the individual regarding their social functioning and perceived difficulties, without incorporating objective neuropsychological measures. Option D. Utilize a single, widely recognized cognitive screening instrument that provides a general overview of cognitive functioning, assuming that deficits in social cognition will be evident if present. The correct answer is B. Administer a broad battery of neuropsychological tests that includes measures specifically designed to assess theory of mind, emotion recognition, social perception, and executive functions that underpin social cognition, supplemented by structured interviews and collateral information to contextualize findings and assess for response bias. Explanation. This scenario presents a professional challenge due to the inherent complexity of assessing social cognition in a forensic context. Neuropsychologists must navigate the potential for malingering, the subjective nature of social interactions, and the need for culturally sensitive interpretations, all while adhering to strict ethical and legal standards. The assessment must be robust enough to withstand scrutiny in legal proceedings, requiring a systematic and evidence-based approach. The correct approach represents best professional practice because it prioritizes a comprehensive, multi-method assessment that directly addresses the referral question within the legal framework. This involves utilizing a battery of tests specifically designed to evaluate various facets of social cognition, incorporating collateral information, and employing structured interview techniques to gather contextual data. This systematic approach ensures that the findings are reliable, valid, and directly relevant to the legal question, aligning with the ethical principles of competence, integrity, and beneficence, as well as the legal requirements for expert testimony. The emphasis on differential diagnosis, including the consideration of malingering, is crucial in forensic neuropsychology to ensure the integrity of the assessment and the accuracy of the conclusions. An incorrect approach that relies solely on a single, broad cognitive screening instrument fails to meet the standards of a comprehensive neuropsychological evaluation for social cognition. This approach is ethically deficient as it lacks the specificity and depth required to adequately assess complex social cognitive deficits, potentially leading to inaccurate conclusions. It also violates professional guidelines that mandate the use of appropriate, validated measures for the constructs being assessed, Another incorrect approach that focuses exclusively on self-report measures without objective assessment is problematic. This overlooks the potential for response bias and fails to capture the objective manifestations of social cognitive impairments. Ethically, this approach is insufficient as it does not provide a balanced and objective evaluation, potentially misrepresenting the individual's functional capacity. An approach that neglects to consider the influence of cultural factors and potential for malingering is also professionally unacceptable. Social cognition is heavily influenced by cultural norms and expectations. Failing to account for these can lead to misinterpretations of behavior. Furthermore, in forensic settings, the possibility of malingering must always be considered and systematically evaluated. An assessment that ignores these critical elements is ethically compromised and legally unsound, as it may not accurately reflect the individual's true cognitive functioning or may be susceptible to manipulation. Professionals should employ a decision-making process that begins with a thorough understanding of the referral question and the legal context. This involves selecting assessment tools and methods that are empirically supported for the constructs of interest, considering the individual's background and potential confounding factors, e.g., cultural background, educational history, presence of psychiatric conditions, and systematically evaluating for response bias or malingering. The process should be iterative, with findings from one assessment component informing the selection and interpretation of others. Finally, conclusions must be clearly articulated, directly addressing the referral question and supported by the totality of the evidence, while acknowledging any limitations of the assessment. Question 5. Strategic planning requires a neuropsychologist to accurately assess the potential risks associated with a patient's diagnosed neurological condition. Given a patient with a lesion in the dorsolateral prefrontal cortex, which neuroanatomical and neurophysiological considerations are most critical for evaluating their capacity for impulse control and judgment, thereby informing risk assessment? Option A. Reviewing the patient's educational history and occupational background to understand their baseline cognitive abilities and life experiences. Option B. Assessing the patient's overall mood and affect, and considering the impact of any prescribed psychotropic medications on their general cognitive functioning. Option C. Evaluating the integrity of the dorsolateral prefrontal cortex and its connections to the anterior cingulate cortex and basal ganglia, and understanding their roles in executive functions such as inhibitory control and decision-making. Option D. Focusing on the patient's self-reported awareness of their condition and their ability to articulate their symptoms without considering the underlying neural mechanisms. The correct answer is C. Evaluating the integrity of the dorsolateral prefrontal cortex and its connections to the anterior cingulate cortex and basal ganglia, and understanding their roles in executive functions such as inhibitory control and decision-making. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neuropsychologist to integrate complex neuroanatomical knowledge with an understanding of neurophysiological processes to assess risk in a patient with a known neurological condition. The challenge lies in translating observable behaviors and reported symptoms into potential underlying neural mechanisms, and then evaluating the implications of these mechanisms for patient safety and functional capacity. This necessitates a nuanced understanding of how specific brain regions and their connections contribute to executive functions, impulse control, and judgment, all of which are critical for risk assessment. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core of neuropsychological assessment in risk evaluation. By focusing on the specific neuroanatomical structures and their known neurophysiological functions implicated in the patient's condition, e.g., prefrontal cortex for executive functions, limbic system for emotional regulation, the neuropsychologist can make a more precise and evidence-based determination of risk. This aligns with the ethical imperative to provide competent and scientifically grounded evaluations, ensuring that recommendations are directly linked to the patient's underlying neurobiology. This approach prioritizes a deep understanding of the brain-behavior relationship, which is fundamental to the practice of neuropsychology and is implicitly supported by the standards of practice expected by the American Board of Professional Neuropsychology, which emphasizes rigorous scientific and clinical application. Incorrect approach is analysis. One incorrect approach would be to rely solely on general behavioral observations without attempting to link them to specific neuroanatomical or neurophysiological deficits. This fails to leverage the specialized knowledge of a neuropsychologist and could lead to superficial or inaccurate risk assessments. Ethically, this could be considered a failure of competence, as it does not utilize the full scope of the professional's expertise. Another incorrect approach would be to overemphasize the patient's subjective report of symptoms without objective neurophysiological or neuroanatomical correlates. While subjective experience is important, a neuropsychological risk assessment must be grounded in objective findings and an understanding of the biological underpinnings of behavior. Relying solely on subjective reports without considering the neurobiological basis could lead to misinterpretations of risk and potentially inappropriate interventions. This would also fall short of the rigorous scientific standards expected. A third incorrect approach would be to make broad generalizations about the patient's condition without considering the individual variability in neuroanatomical presentation and neurophysiological functioning. Each patient's brain is unique, and the impact of neurological conditions can vary significantly. Failing to account for this individual variability would be a failure of personalized assessment and could lead to inaccurate risk estimations. This would also contravene the principle of providing individualized and evidence-based care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough review of the patient's history, including the specific neurological condition and its known impact on brain structures and functions. This should be followed by a comprehensive neuropsychological assessment designed to evaluate relevant cognitive and behavioral domains. The interpretation of assessment findings must then be integrated with existing knowledge of neuroanatomy and neurophysiology to form hypotheses about the underlying neural mechanisms contributing to the observed deficits and potential risks. Finally, these hypotheses should be used to formulate a risk assessment and recommendations that are specific, evidence-based, and directly linked to the patient's neurobiological profile. This iterative process ensures that the assessment is both scientifically sound and clinically relevant, upholding the highest standards of professional practice. Question 6. Regulatory review indicates that neuropsychological evaluations are expected to adhere to established standards for assessment validity and reliability. A neuropsychologist is considering the best approach for assessing a client's executive functions. One option involves a battery of well-validated, norm-referenced standardized tests, while another option proposes a comprehensive interview, direct observation of task performance without specific scoring rubrics, and a review of collateral information. Which approach best aligns with current professional and regulatory expectations for neuropsychological assessment? Option A. Relying primarily on a comprehensive interview, direct observation of task performance without specific scoring rubrics, and a review of collateral information. Option B. Employing a mix of standardized tests and non-standardized observations, with the non-standardized observations carrying equal weight in the final interpretation. Option C. Prioritizing the clinician's extensive experience with a particular non-standardized assessment technique that has yielded subjectively useful insights in past cases. Option D. Utilizing a battery of well-validated, norm-referenced standardized tests. The correct answer is D. Utilizing a battery of well-validated, norm-referenced standardized tests. Explanation. This scenario presents a professional challenge because neuropsychologists are ethically and legally obligated to utilize assessment tools that are valid, reliable, and appropriate for the specific referral question and client population. The tension arises when a clinician's experience with a non-standardized method, while potentially yielding rich qualitative data, may not meet the rigorous psychometric standards expected for diagnostic and treatment planning purposes, especially when compared to established standardized instruments. Careful judgment is required to balance the depth of qualitative information with the objective, norm-referenced data provided by standardized tests. The correct approach represents best professional practice because it prioritizes the use of standardized assessment that have undergone rigorous validation and norming. This aligns with the ethical principles of competence and the responsible use of psychological assessments, as outlined by professional organizations, and implicitly supported by regulatory frameworks that emphasize evidence-based practice. Standardized tests provide objective, quantifiable data that can be compared to normative groups, allowing for more reliable and valid inferences about a client's cognitive functioning relative to their peers. This is crucial for accurate diagnosis, treatment planning, and communicating findings to other professionals and stakeholders. An incorrect approach that relies solely on non-standardized assessments fails to meet professional standards by potentially introducing significant bias and lacking the psychometric rigor necessary for reliable interpretation. This can lead to inaccurate conclusions about a client's cognitive strengths and weaknesses, potentially resulting in inappropriate interventions or misdiagnosis. Ethically, this violates the principle of beneficence and non-maleficence, as it risks causing harm through flawed assessment. Regulatory failure would stem from not adhering to established guidelines for psychological assessment, which generally mandate the use of psychometrically sound instruments. Another incorrect approach that over-relies on anecdotal observations without systematic documentation or comparison to established norms also falls short. While clinical intuition is valuable, it must be grounded in objective data. Without standardization, observations are subject to individual interpretation and may not be generalizable or replicable. This can lead to subjective conclusions that lack the empirical support required for professional accountability. The professional decision-making process for similar situations should involve a systematic evaluation of the referral question, the client's characteristics, and the available assessment tools. Clinicians must consider the psychometric properties of both standardized and non-standardized methods, their relevance to the specific clinical question, and their ethical implications. When using non-standardized methods, it is imperative to clearly articulate their limitations and to integrate them cautiously with data from standardized assessments, rather than allowing them to supersede more objective measures. The ultimate goal is to provide the most accurate, reliable, and valid assessment possible to benefit the client. Question 7. Stakeholder feedback indicates a need for improved clarity on how neuropsychologists should manage patient expectations regarding recovery timelines and functional outcomes following moderate to severe traumatic brain injury. Considering the inherent variability in brain injury recovery processes, which of the following approaches best aligns with current professional standards and ethical guidelines for the American Board of Professional Neuropsychology? Option A. Provide a definitive prognosis for recovery based on established normative data for similar injury types, emphasizing that interventions will focus on achieving these predetermined outcomes. Option B. Develop an individualized recovery trajectory based on initial assessment findings, incorporating ongoing reassessment and adaptive intervention strategies, while maintaining transparent communication with the patient and stakeholders about potential variability and progress. Option C. Focus primarily on symptom management and compensatory strategies, with limited emphasis on predicting or influencing the ultimate trajectory of neurological recovery. Option D. Establish a fixed treatment duration based on the severity of the injury, with the expectation that functional gains will plateau at a predictable point within that time frame. The correct answer is B. Develop an individualized recovery trajectory based on initial assessment findings, incorporating ongoing reassessment and adaptive intervention strategies, while maintaining transparent communication with the patient and stakeholders about potential variability and progress. Explanation. This scenario presents a professional challenge due to the inherent variability in brain injury recovery processes and the need to align neuropsychological assessment and intervention with evolving patient needs and stakeholder expectations. Professionals must navigate the complexities of predicting recovery trajectories, managing expectations, and ensuring that interventions are evidence-based and ethically sound, all within the framework of professional standards and guidelines. The correct approach represents best professional practice because it emphasizes a dynamic, individualized, and collaborative model of care. This aligns with the American Board of Professional Neuropsychology's commitment to evidence-based practice and ethical conduct, which necessitates ongoing assessment, adaptation of interventions based on observed progress, and clear communication with the patient and relevant stakeholders. This approach prioritizes patient well-being and functional recovery by acknowledging the plasticity of the brain and the potential for continued improvement, even after initial stabilization. It also reflects a commitment to professional accountability by ensuring that interventions are responsive to the patient's evolving needs and that progress is systematically monitored. An incorrect approach that focuses solely on initial prognostication without ongoing reassessment fails to acknowledge the dynamic nature of brain injury recovery. This can lead to premature cessation of beneficial interventions or the setting of unrealistic expectations, potentially causing patient distress and hindering optimal outcomes. Ethically, this approach may violate principles of beneficence and non-maleficence by not providing the most appropriate and timely care. Another incorrect approach that relies on generalized recovery timelines without considering individual patient factors overlooks the unique biological and psychosocial influences on recovery. This can result in a one-size-fits-all approach that is neither effective nor efficient and may not meet the specific needs of the individual. This also risks violating principles of justice by not providing equitable care tailored to individual circumstances. A further incorrect approach that prioritizes symptom management over functional restoration may address immediate concerns, but fails to address the broader goals of rehabilitation, which typically include maximizing independence and quality of life. While symptom management is crucial, it should be integrated within a comprehensive recovery plan that aims for functional gains. This approach could be seen as a failure to fully uphold the principle of beneficence by not pursuing the most comprehensive and beneficial recovery possible. The professional decision-making process for similar situations should involve a thorough initial assessment, followed by the development of a treatment plan that includes clear, measurable goals. This plan should be regularly reviewed and revised based on ongoing assessment of the patient's progress, response to interventions, and any changes in their circumstances. Open and honest communication with the patient and their support network is paramount throughout this process, ensuring that everyone is aligned on the goals and the path forward. Professionals must remain current with research on brain injury recovery and adapt their practices accordingly, always prioritizing the patient's best interests and adhering to ethical and professional standards. Question 8. Operational review demonstrates that a neuropsychologist is evaluating a patient with a referral question concerning potential early-stage neurodegenerative disease, with subtle changes in memory and executive function reported by the family. The neuropsychologist is considering different test battery approaches. Which of the following approaches best aligns with the rigorous standards expected for a comprehensive diagnostic neuropsychological evaluation under the American Board of Professional Neuropsychology (APN) guidelines? Option A. A battery that includes a very broad range of tests, including many measures of personality and emotional functioning, even though the referral question is primarily focused on cognitive decline. Option B. A comprehensive battery that includes standardized measures of attention, memory, verbal and visual, language, visuospatial skills, executive functions, planning, inhibition, cognitive flexibility, and processing speed, with specific tests chosen to address the nuances of the referral question and potential differential diagnoses. Option C. A battery that includes several novel or experimental cognitive measures that have shown promise in preliminary research, but lack extensive psychometric validation and normative data. Option D. A brief screening battery consisting of only a few widely recognized cognitive screening instruments to quickly assess for gross cognitive impairment. The correct answer is B. A comprehensive battery that includes standardized measures of attention, memory, verbal and visual, language, visuospatial skills, executive functions, planning, inhibition, cognitive flexibility, and processing speed, with specific tests chosen to address the nuances of the referral question and potential differential diagnoses. Explanation. This scenario presents a professional challenge due to the inherent variability in neuropsychological test performance and the critical need for accurate diagnostic interpretation within the American Board of Professional Neuropsychology (APN) framework. The clinician must balance the efficiency of a brief battery with the comprehensiveness required for a robust differential diagnosis, particularly when subtle cognitive deficits might be present. The APN emphasizes evidence-based practice and adherence to ethical guidelines, which necessitate a thorough assessment that minimizes the risk of misdiagnosis or overlooking significant pathology. The correct approach represents best professional practice by prioritizing a comprehensive assessment that aligns with the APN standards for clinical neuropsychology. This involves selecting a battery that adequately samples the core cognitive domains relevant to the referral question, allowing for a nuanced interpretation of performance patterns. Such an approach ensures that the assessment is sensitive to a wide range of potential neurological and psychiatric conditions, thereby supporting accurate diagnosis and appropriate treatment planning. This aligns with ethical principles of beneficence and non-maleficence, ensuring the patient receives the most accurate and beneficial evaluation possible. An incorrect approach that relies solely on a brief, screening-level battery fails to meet the depth of assessment expected for a diagnostic neuropsychological evaluation. This could lead to overlooking subtle but clinically significant deficits, resulting in an inaccurate diagnosis and potentially inappropriate interventions. Ethically, this constitutes a failure to provide a competent and thorough evaluation, potentially violating principles of due care. Another incorrect approach that involves an overly broad, non-targeted battery without clear justification for each test risks inefficiency and can lead to data overload, making interpretation more challenging and potentially less precise. While comprehensiveness is important, it must be balanced with clinical relevance. This approach may not directly violate a specific regulation, but represents a suboptimal use of resources and can detract from the clarity of the diagnostic conclusions, indirectly impacting the quality of care. A further incorrect approach that substitutes a non-standardized or experimental measure for a well-established, validated neuropsychological test would be a significant ethical and professional failing. The APBIN expects the use of psychometrically sound instruments with known reliability and validity. Employing unvalidated measures introduces a high risk of unreliable data, leading to misinterpretations and potentially harmful clinical decisions, violating the core tenets of evidence-based practice and professional competence. Professional decision-making process in such situations should involve a systematic evaluation of the referral question, consideration of the patient's history and presenting symptoms, and a deliberate selection of assessment tools that are known to be sensitive and specific to the suspected conditions. This process should be guided by current best practices in neuropsychology, ethical guidelines, and the specific requirements of professional certification bodies like the APBIN. Clinicians must be prepared to justify their choice of battery and interpret findings within the context of the limitations of the chosen instruments. Question 9. Implementation of a neuropsychological evaluation for a patient referred by a primary care physician for concerns of cognitive decline requires a report that effectively communicates findings. Which of the following approaches best ensures the report is clinically useful and ethically sound for the referring physician? Option A. A report that meticulously details all raw test scores, statistical analyses, and diagnostic criteria, assuming the referring physician possesses advanced knowledge of neuropsychological assessment methodologies. Option B. A report that utilizes highly technical neuropsychological terminology and complex statistical descriptors to convey the precision of the assessment, without providing supplementary explanations. Option C. A report that clearly articulates the patient's cognitive strengths and weaknesses, translates statistical findings into observable behavioral implications, and provides specific, actionable recommendations for management and further investigation, using language accessible to a non-specialist. Option D. A report that includes a brief summary of the most significant findings, but omits detailed explanations of less critical results to maintain conciseness, even if those results could offer nuanced insights. The correct answer is C. A report that clearly articulates the patient's cognitive strengths and weaknesses, translates statistical findings into observable behavioral implications, and provides specific, actionable recommendations for management and further investigation, using language accessible to a non-specialist. Explanation. This scenario presents a common challenge in neuropsychological practice, effectively communicating complex findings to a non-specialist audience, specifically a primary care physician. The primary care physician requires actionable information to guide patient care, but may lack the specialized knowledge to interpret detailed neuropsychological terminology or statistical significance without context. The neuropsychologist's report must bridge this gap, ensuring clarity, accuracy, and utility. The correct approach emphasizes translating technical findings into clinically relevant implications. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient receives appropriate care based on accurate and understandable information. It also adheres to professional guidelines for report writing, which mandate clear, concise, and relevant communication tailored to the intended audience. Specifically, the American Board of Professional Neuropsychology, APBIN, standards for professional practice emphasize the importance of reports that are understandable and useful to referring professionals. thereby facilitating optimal patient outcomes. An incorrect approach that focuses solely on presenting raw data or statistical results without interpretation fails to meet the needs of the referring physician and could lead to misinterpretation or inaction. This neglects the professional responsibility to ensure the findings are understood and applied effectively. Another incorrect approach that uses overly technical jargon without explanation creates a barrier to understanding, potentially leading to diagnostic or treatment errors, which is a violation of the duty of care. Finally, an approach that omits critical findings due to perceived complexity or time constraints is a failure to provide a comprehensive and accurate assessment, undermining the referral process and potentially harming the patient. Professionals should approach report writing by first considering the referral question and the intended audience. They should then structure the report logically, beginning with a summary of key findings and their clinical implications. Technical terms should be defined or explained in simpler language, and the focus should remain on how the neuropsychological findings inform diagnosis, prognosis, and treatment recommendations. Regular review of professional guidelines and ethical codes related to documentation and communication is essential for maintaining best practices. Question 10. The performance metrics show a notable decline in processing speed and executive function scores over the past 6 months, prompting concern about a potential neurocognitive decline. Which of the following represents the most appropriate initial professional response? Option A. Advise the individual to focus on lifestyle changes such as improved sleep and diet and reevaluate in 1 year. Option B. Immediately implement a cognitive rehabilitation program targeting executive functions based on the observed performance metric changes. Option C. Rely solely on the individual's subjective report of their cognitive difficulties to guide further action. Option D. Conduct a comprehensive neuropsychological evaluation to thoroughly assess cognitive, emotional, and behavioral functioning. The correct answer is D. Conduct a comprehensive neuropsychological evaluation to thoroughly assess cognitive, emotional, and behavioral functioning. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a neuropsychologist to balance the immediate need for intervention with the ethical imperative of thorough assessment and the potential for misinterpretation of performance data. The performance metrics, while indicative of a potential issue, are not diagnostic in themselves and can be influenced by numerous factors unrelated to a neuropsychological disorder. Over-reliance on these metrics without a comprehensive neuropsychological evaluation risks misdiagnosis, inappropriate treatment, and potential harm to the individual. The professional challenge lies in discerning the true nature of the observed changes and ensuring that any subsequent actions are evidence-based and ethically sound, adhering to the standards of practice for neuropsychologists. Correct approach analysis. The correct approach emphasizes a comprehensive neuropsychological evaluation as the foundational step. This aligns with the ethical principles and professional standards of the American Board of Professional Neuropsychology, which mandate a thorough assessment before any diagnostic conclusions or treatment recommendations are made. A comprehensive evaluation allows for the systematic investigation of cognitive, emotional, and behavioral domains, considering the individual's history, collateral information, and objective test performance. This approach ensures that any observed deficits are understood within the broader context of the individual's functioning, leading to accurate diagnosis and appropriate, individualized interventions. It upholds the principle of beneficence by ensuring that interventions are based on sound clinical judgment and evidence, and non-maleficence by avoiding premature or incorrect interventions. Incorrect approaches analysis. One incorrect approach involves immediately initiating a specific intervention based solely on the performance metrics. This fails to adhere to the fundamental requirement of a diagnostic evaluation. It represents a regulatory and ethical failure because it bypasses the necessary steps for establishing a diagnosis, potentially leading to the misapplication of treatments for conditions that are not present or are misidentified. This violates the principle of competence and the duty to provide evidence-based care. Another incorrect approach is to dismiss the performance metrics entirely without further investigation. While caution is warranted, ignoring objective data that suggests a change in functioning is also professionally unsound. This could lead to a failure to identify a genuine neuropsychological disorder, thereby neglecting the individual's need for assessment and potential treatment, which is a breach of the duty to care and the principle of beneficence. A third incorrect approach is to rely solely on self-report or collateral information without objective neuropsychological testing to interpret the performance metrics. While subjective reports are valuable, they are not a substitute for objective assessment in neuropsychology. This approach risks confirmation bias and can lead to inaccurate conclusions, as subjective experiences may not always reflect underlying cognitive or neurological changes. It fails to meet the professional standards for diagnostic accuracy in neuropsychology. Professional reasoning. Professionals should approach such situations by first acknowledging the significance of the performance metrics as a signal for further investigation. The next step is to initiate a comprehensive neuropsychological evaluation, which includes a detailed clinical interview, review of records, and administration of standardized neuropsychological tests. This systematic process allows for the differential diagnosis of potential neuropsychological disorders, consideration of contributing factors, e.g., medical conditions, psychological distress, environmental influences, and the development of an evidence-based treatment plan. Professionals must continuously engage in critical thinking, integrating all available data to arrive at the most accurate and ethically sound conclusions, always prioritizing the well-being and best interests of the individual. Question 11. Process analysis reveals that a neuropsychologist is evaluating a child exhibiting significant challenges in executive functions and learning. The child's developmental history indicates a period of early adversity. The neuropsychologist is considering how to best conceptualize the impact of neuroplasticity and brain development on the child's current presentation and to formulate appropriate recommendations. Which of the following approaches best reflects current best practices in neuropsychological assessment and intervention planning for such a case? Option A. Focus solely on identifying specific neurological lesions or structural abnormalities that might explain the executive function deficits, and recommend interventions primarily aimed at compensating for these identified structural limitations. Option B. Propose novel, unproven therapeutic techniques that claim to rapidly enhance neuroplasticity, based on emerging but not yet widely validated research findings, without a comprehensive assessment of the child's specific needs. Option C. Prioritize interventions that address the immediate behavioral manifestations of the executive function deficits, without deeply exploring the underlying developmental trajectory or the potential for long-term neuroplastic changes. Option D. Recommend a broad range of evidence-based interventions targeting executive functions and learning, emphasizing strategies that promote cognitive flexibility and adaptive functioning, while acknowledging the potential for ongoing developmental changes and the influence of early experiences on neural pathways. The correct answer is D. Recommend a broad range of evidence-based interventions targeting executive functions and learning, emphasizing strategies that promote cognitive flexibility and adaptive functioning, while acknowledging the potential for ongoing developmental changes and the influence of early experiences on neural pathways. Explanation. This scenario presents a professional challenge due to the inherent complexity of assessing and intervening in neuroplasticity and brain development in a clinical neuropsychology setting. Neuroplasticity is a dynamic process, and its manifestations can vary significantly across individuals and developmental stages. A neuropsychologist must navigate the ethical imperative to provide evidence-based care while acknowledging the evolving nature of scientific understanding and the potential for individual differences in response to interventions. The challenge lies in balancing established best practices with the need for individualized assessment and intervention planning, ensuring that recommendations are both scientifically sound and clinically appropriate for the specific patient. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted evaluation that integrates current neuroscientific understanding of neuroplasticity with the individual's unique developmental trajectory and clinical presentation. This approach aligns with the American Board of Professional Neuropsychology's commitment to evidence-based practice and ethical conduct, which mandates thorough assessment before recommending interventions. It acknowledges that interventions targeting neuroplasticity should be tailored to the individual's specific cognitive, emotional, and behavioral profile, considering their developmental stage and any co-occurring conditions. This individualized approach ensures that recommendations are not only theoretically sound, but also practically applicable and ethically justifiable, maximizing the potential for positive outcomes while minimizing risks. An incorrect approach that focuses solely on a single theoretical model of neuroplasticity, without considering the individual's comprehensive neuropsychological profile, would be a regulatory and ethical failure. This would violate the principle of individualized care, potentially leading to inappropriate or ineffective interventions. It could also be seen as a failure to adhere to evidence-based practice, as it relies on a narrow interpretation of the literature without sufficient clinical validation for the specific patient. Another incorrect approach that proposes interventions based on anecdotal evidence or unvalidated techniques would represent a significant ethical lapse and a violation of professional standards. This would disregard the requirement for interventions to be supported by robust scientific evidence and could expose the patient to harm or exploitation. Furthermore, an approach that neglects to consider the developmental context of the patient's brain development and neuroplasticity would be a failure to apply core principles of neuropsychological assessment, leading to misinterpretations of findings and potentially detrimental recommendations. Professional decision-making in such situations requires a systematic process. First, a thorough review of the patient's history, presenting concerns and existing data is essential. Second, a comprehensive neuropsychological assessment should be conducted, employing a battery of tests that are appropriate for the patient's age and suspected deficits, with a specific focus on cognitive functions known to be influenced by neuroplasticity. Third, the assessment findings should be interpreted within the context of current neuroscientific literature on neuroplasticity and brain development, considering individual differences and developmental factors. Fourth, potential interventions should be evaluated based on their empirical support, clinical relevance, and ethical considerations, always prioritizing the patient's well-being and autonomy. Finally, recommendations should be clearly communicated to the patient and/or their caregivers, with a discussion of potential benefits, risks, and alternatives. Question 12. The control framework reveals that a neuropsychologist is evaluating a patient presenting with a complex array of cognitive and behavioral changes following a mild traumatic brain injury. The patient reports significant difficulties with attention, memory, and executive functions, alongside notable emotional lability and irritability. While some symptoms are consistent with post-concussive syndrome, other features raise concerns for a potential underlying neurodegenerative process or a primary mood disorder with significant cognitive impact. The neuropsychologist has completed initial interviews and administered a battery of cognitive tests. Which of the following represents the most ethically and professionally sound next step in the diagnostic and treatment planning process, adhering strictly to the standards of the American Board of Professional Neuropsychology? Option A. Recommend a comprehensive neuropsychological reevaluation in 6 months to observe symptom progression and allow for potential spontaneous remission of some symptoms. Option B. Formulate a definitive diagnosis and initiate a treatment plan based on the most prominent symptom cluster, while acknowledging the possibility of other contributing factors in the report. Option C. Conduct further targeted neuropsychological testing to specifically differentiate between the suspected conditions. Consult with relevant specialists, e.g., neurologist, psychiatrist, for their diagnostic input and integrate all findings into a differential diagnosis and a phased treatment plan. Option D. Provide the patient with a list of potential diagnoses and recommend they consult with other specialists independently to determine the most appropriate course of action. The correct answer is B. Formulate a definitive diagnosis and initiate a treatment plan based on the most prominent symptom cluster, while acknowledging the possibility of other contributing factors in the report. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and managing neuropsychological disorders, particularly when a patient exhibits overlapping or atypical symptom presentations. The neuropsychologist must navigate the ethical imperative to provide competent care while respecting patient autonomy and confidentiality, all within the established professional standards and regulatory guidelines of the American Board of Professional Neuropsychology (APPN). The need for accurate diagnosis, appropriate intervention planning, and clear communication with the patient and other healthcare providers necessitates a thorough and systematic approach. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-based evaluation. This involves a detailed history, standardized neuropsychological testing, and consideration of differential diagnoses. It aligns with APPIN's commitment to high standards of practice, emphasizing the importance of a thorough assessment to ensure an accurate diagnosis and the development of an individualized treatment plan. This approach respects the patient's right to informed consent and promotes a collaborative relationship, fostering trust and adherence to recommendations. Ethical guidelines, such as those promoted by the APPIN, mandate that practitioners only offer services for which they are qualified, and that their assessments are thorough and unbiased. An incorrect approach that involves prematurely concluding a diagnosis based on limited information or a single symptom cluster would represent a failure to adhere to the principles of competent practice. This could lead to misdiagnosis, inappropriate treatment, and potential harm to the patient. Ethically, this would violate the duty of care and the principle of beneficence. Another incorrect approach, such as failing to adequately document the assessment process and findings, would violate professional record-keeping standards and could impede continuity of care or future evaluations. This also undermines accountability and transparency, which are crucial for professional integrity. Furthermore, an approach that involves sharing diagnostic impressions or treatment recommendations with unauthorized individuals would constitute a breach of patient confidentiality, a fundamental ethical and legal obligation. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the presenting problem and relevant diagnostic criteria. This involves consulting current literature, diagnostic manuals e.g. DSM-5-TR, and established neuropsychological assessment protocols. When faced with diagnostic uncertainty, seeking consultation with peers or supervisors is a critical step. The process should always prioritize the patient's well-being, ensuring that all diagnostic and treatment decisions are made in their best interest and with their informed participation. Adherence to ethical codes and regulatory requirements, such as those overseen by the APPIN, provides the essential framework for navigating complex clinical situations and ensuring high-quality patient care. Question 13. Investigation of evidence-based practices in cognitive rehabilitation for a patient with moderate traumatic brain injury and significant executive dysfunction. What is the most appropriate approach for selecting and implementing interventions? Option A. Exclusively utilize interventions that are explicitly detailed in widely published, but potentially outdated, clinical manuals, disregarding any newer research or individual patient variations. Option B. Prioritize interventions with robust empirical support for improving executive functions, systematically evaluating the literature for studies demonstrating efficacy in similar patient populations, and integrating findings with the patient's specific functional goals and preferences. Option C. Implement a single, highly specialized intervention that has shown promise in a very specific research setting, without thoroughly assessing its applicability or the patient's broader needs. Option D. Select interventions based on the clinician's extensive personal experience with similar cases, assuming that what has worked anecdotally in the past will be effective for this patient. The correct answer is B. Prioritize interventions with robust empirical support for improving executive functions, systematically evaluating the literature for studies demonstrating efficacy in similar patient populations, and integrating findings with the patient's specific functional goals and preferences. Explanation. This scenario presents a common challenge in neuropsychological practice, balancing the need for evidence-based interventions with the unique, often complex, needs of individual patients. The professional challenge lies in discerning which cognitive rehabilitation strategies are most likely to yield positive outcomes for a specific patient profile, considering the current state of scientific literature and the practical limitations of implementation. Careful judgment is required to avoid adopting unproven methods or rigidly adhering to protocols that may not be optimal for a given individual. Correct approach represents best professional practice because it prioritizes interventions with a strong foundation in empirical research, aligning with the principles of evidence-based practice that are central to ethical and effective neuropsychological care. This involves systematically reviewing the literature, considering the quality and relevance of studies, and integrating this information with the patient's specific cognitive profile, functional goals, and personal circumstances. Adherence to the American Board of Professional Neuropsychology's ethical guidelines and standards of practice necessitates the use of scientifically validated methods. An incorrect approach that relies solely on anecdotal evidence or personal clinical experience without reference to empirical data fails to meet the standards of professional accountability. This can lead to the application of ineffective or even detrimental interventions, violating the ethical obligation to provide competent care and potentially misrepresenting the efficacy of services. Another incorrect approach might involve the uncritical adoption of a single, highly specialized intervention without considering its generalizability or the patient's suitability, which can be seen as a failure to engage in a thorough assessment and treatment planning process, thus not adhering to best practices for patient-centered care. A further incorrect approach could be to dismiss all interventions not explicitly listed in a narrow set of guidelines, thereby limiting the potential for innovation and personalized care, and potentially failing to consider emerging evidence that might be beneficial. Professionals should employ a decision-making framework that begins with a comprehensive neuropsychological assessment to identify specific cognitive deficits and functional impairments. This is followed by a thorough review of the current evidence base for cognitive rehabilitation strategies targeting those identified deficits. The next step involves a collaborative discussion with the patient and their family to establish realistic and meaningful functional goals. Treatment planning then integrates the evidence, patient goals, and individual factors e.g., motivation, support systems, comorbidities, to select the most appropriate and feasible interventions. Ongoing monitoring of progress and adaptation of the treatment plan based on empirical outcomes are crucial components of this process. Question 14. What factors determine the most effective principles of cognitive rehabilitation for an individual with a specific acquired brain injury, considering both objective cognitive assessments and the patient's functional goals? Option A. The patient's reported satisfaction with a particular therapeutic approach, alongside objective measures of cognitive improvement and the neuropsychologist's clinical judgment regarding functional applicability. Option B. The patient's stated preference for a therapy that aligns with popular trends in cognitive enhancement, irrespective of diagnostic specificity. Option C. A singular focus on improving performance on standardized cognitive tests without regard for functional outcomes or patient preferences. Option D. The availability of specific rehabilitation technologies, regardless of their evidence base for the patient's particular cognitive deficits. The correct answer is A. The patient's reported satisfaction with a particular therapeutic approach, alongside objective measures of cognitive improvement and the neuropsychologist's clinical judgment regarding functional applicability. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a neuropsychologist to balance the patient's subjective experience of progress with objective measures of cognitive function, while also considering the ethical imperative to provide evidence-based interventions. The patient's desire for a specific type of therapy, even if not fully supported by current evidence for their particular deficit, creates a tension between patient autonomy and professional responsibility. Careful judgment is required to ensure the intervention is both effective and ethically sound, adhering to the principles of beneficence and non-maleficence. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's cognitive deficits and functional limitations. This aligns with the American Board of Professional Neuropsychology's emphasis on evidence-based practice and the ethical guidelines that mandate interventions be tailored to the specific needs and capacities of the individual. By considering the patient's goals, the neuropsychologist ensures that rehabilitation efforts are meaningful and motivating, thereby enhancing engagement and potential for positive outcomes. This approach also necessitates ongoing evaluation of treatment efficacy, allowing for adjustments to optimize the rehabilitation plan. This is consistent with the ethical obligation to provide competent and effective care. Incorrect approach is analysis. One incorrect approach would be to solely rely on the patient's self-report of improvement without objective cognitive assessment. This fails to adhere to the principle of evidence-based practice, as subjective reports can be influenced by factors other than actual cognitive gains. Ethically, this could lead to a misallocation of resources and a failure to address underlying cognitive impairments, potentially violating the duty of care. Another incorrect approach would be to rigidly adhere to a single, unproven therapeutic modality simply because the patient expresses a strong preference, disregarding objective evidence of its efficacy for the specific cognitive deficits identified. This disregards the neuropsychologist's professional responsibility to utilize interventions with demonstrated effectiveness, potentially leading to patient harm through ineffective treatment and delaying access to more beneficial therapies. This also raises concerns about informed consent, as the patient may not be fully aware of the limitations of the chosen approach. A third incorrect approach would be to focus exclusively on abstract cognitive skills in a laboratory setting without considering how these skills translate to real-world functional improvements. While cognitive remediation aims to improve cognitive function, the ultimate goal is to enhance the patient's ability to participate in daily life. Failing to bridge this gap between cognitive performance and functional outcomes neglects a core principle of neuropsychological rehabilitation and may not lead to meaningful improvements for the patient. This could be seen as a failure to provide comprehensive and functional rehabilitation. Professional reasoning. Professionals should approach cognitive rehabilitation by first conducting a thorough neuropsychological evaluation to identify specific cognitive strengths and weaknesses. This forms the foundation for setting individualized, measurable goals in collaboration with the patient. The selection of interventions should be guided by the best available scientific evidence for the identified deficits, while also considering the patient's preferences and functional goals. Regular monitoring of progress using both objective and subjective measures is crucial, with flexibility to adapt the treatment plan as needed. This iterative process ensures that rehabilitation is effective, ethical, and patient-centered. Question 15. When evaluating the optimal neuropsychological test battery for a specific patient, what is the most ethically and professionally sound approach according to the American Board of Professional Neuropsychology's framework? Option A. Select tests based on a thorough review of the referral question, the individual's demographic and experiential background, and the psychometric properties of the tests, ensuring they are appropriate for the specific patient. Option B. Prioritize the use of the newest and most widely marketed neuropsychological tests, assuming they represent the most current and effective assessment methods. Option C. Choose tests based on the clinician's personal familiarity and ease of administration, focusing on tests that are quick to score and interpret. Option D. Administer a standardized, comprehensive battery of tests that has been historically used by the clinician, regardless of the specific referral question or individual characteristics. The correct answer is A. Select tests based on a thorough review of the referral question, the individual's demographic and experiential background, and the psychometric properties of the tests, ensuring they are appropriate for the specific patient. Explanation. This scenario presents a professional challenge due to the inherent variability in neuropsychological test performance and the ethical imperative to select instruments that are both valid and reliable for the specific individual being assessed. Neuropsychological assessment is not a one-size-fits-all endeavor. It requires careful consideration of the referral question, the individual's background, including cultural, linguistic, and educational factors, and the psychometric properties of the tests themselves. The American Board of Professional Neuropsychology, APN, guidelines emphasize the importance of evidence-based practice, which includes selecting tests that have demonstrated utility and appropriate standardization for the population being evaluated. The correct approach represents best professional practice because it prioritizes an individualized, evidence-based selection of assessment tools. This involves a thorough review of the referral question to guide the assessment's focus, consideration of the individual's demographic and experiential background to ensure test appropriateness and minimize bias, and a critical evaluation of the psychometric properties, validity, reliability, standardization of potential tests. This aligns with APN's commitment to maintaining high standards of professional practice and ethical conduct, ensuring that assessments are conducted competently and in the best interest of the patient. An incorrect approach that relies solely on a predetermined battery, without considering individual factors, fails to meet the standards of individualized assessment. This can lead to inaccurate conclusions and potentially inappropriate treatment recommendations, violating the ethical principle of beneficence and non-maleficence. Another incorrect approach that prioritizes the most recently published tests without regard for their psychometric evidence or relevance to the referral question also represents a failure in professional judgment and adherence to evidence-based practice. Furthermore, selecting tests based on personal familiarity or ease of administration, rather than their psychometric adequacy and suitability for the individual, constitutes a lapse in professional responsibility and can lead to biased or invalid results. Professionals should employ a systematic decision-making process that begins with a clear understanding of the referral question. This is followed by a comprehensive review of the individual's history and characteristics. Next, potential assessment tools are identified, and their psychometric properties, normative data, and relevance to the referral question are critically evaluated. The final selection of tests should be a deliberate choice that balances the need for comprehensive data with the practicalities of administration and the individual's capacity to participate. This iterative process ensures that the assessment is both scientifically sound and ethically responsible. Question 16. Quality control measures reveal that a neuropsychologist's report on a patient with suspected executive dysfunction consistently prioritizes findings from fMRI scans, showing reduced prefrontal cortex activation over the results of standardized neuropsychological tests that indicate significant deficits in planning, organization, and cognitive flexibility. The neuropsychologist's diagnostic impression and treatment recommendations are primarily based on the fMRI interpretation. Option A. The neuropsychologist should present both sets of findings as equally weighted, allowing the patient to independently interpret the implications of the neuroimaging and neuropsychological test data. Option B. The neuropsychologist should exclusively rely on neuroimaging findings, such as fMRI, as they provide objective biological evidence of brain function, superseding subjective cognitive test results. Option C. The neuropsychologist should primarily base diagnostic impressions and treatment recommendations on the results of standardized neuropsychological tests, using neuroimaging findings as supplementary information to inform interpretation or guide further investigation, especially when there are discrepancies. Option D. The neuropsychologist should disregard the neuroimaging findings entirely if they do not directly align with the neuropsychological test results, as neuroimaging is not a core component of neuropsychological assessment. The correct answer is C. The neuropsychologist should primarily base diagnostic impressions and treatment recommendations on the results of standardized neuropsychological tests, using neuroimaging findings as supplementary information to inform interpretation or guide further investigation, especially when there are discrepancies. Explanation. This scenario presents a professional challenge due to the inherent variability and interpretation of neuroimaging data in neuropsychological assessment. Neuroimaging, while a powerful tool, is not a direct measure of cognitive function and requires careful integration with behavioral and clinical data. The challenge lies in determining the appropriate level of reliance on neuroimaging findings when they appear to contradict or significantly diverge from established neuropsychological test results, especially when making critical diagnostic or treatment recommendations. This requires a nuanced understanding of the limitations of each assessment modality and adherence to professional standards that prioritize comprehensive evaluation. The correct approach represents best professional practice because it emphasizes a hierarchical and integrated assessment strategy. Neuropsychological testing, grounded in decades of research and validation, provides direct measures of cognitive abilities and deficits. Neuroimaging, while offering insights into brain structure and function, is often correlational and subject to interpretation. Therefore, prioritizing neuropsychological findings as the primary basis for diagnosis and treatment planning, while using neuroimaging as a supplementary or confirmatory tool, aligns with the American Board of Professional Neuropsychology's (APPEN) emphasis on evidence-based practice and the ethical imperative to base conclusions on the most reliable and valid data available. This approach ensures that clinical decisions are primarily driven by direct assessment of cognitive performance, minimizing the risk of misinterpretation of imaging data. An incorrect approach that overemphasizes neuroimaging findings without sufficient corroboration from neuropsychological testing represents a significant regulatory and ethical failure. The APPEN guidelines implicitly and explicitly advocate for a comprehensive neuropsychological evaluation, which is defined by its behavioral and cognitive assessment components. Relying solely or predominantly on neuroimaging which may not directly map to specific cognitive deficits or their severity, could lead to inaccurate diagnoses, inappropriate treatment plans, and potential harm to the patient. This would violate the ethical principle of beneficence and non-maleficence, as well as the professional standard of conducting a thorough and integrated assessment. Another incorrect approach that dismisses neuroimaging findings entirely, even when they offer potentially crucial insights into underlying neuropathology that could explain observed cognitive patterns, is also professionally unsound. While neuropsychological testing is primary, ignoring potentially relevant neuroimaging data that could inform differential diagnosis or guide further investigation would be a failure to utilize all available relevant information, potentially hindering a complete understanding of the patient's condition and contravening the spirit of comprehensive assessment. The professional decision-making process for similar situations should involve a systematic integration of all available data. This includes 1. Thoroughly reviewing and interpreting neuropsychological test results, considering their psychometric properties and clinical significance. 2. Carefully examining neuroimaging findings, understanding their limitations and potential for artifact or misinterpretation. 3. Identifying areas of convergence and divergence between the two modalities. 4. Prioritizing findings from the modality with the strongest direct relevance and established validity for the specific clinical question. 5. Consulting with colleagues or supervisors when significant discrepancies arise or when the interpretation is complex. 6. Clearly documenting the rationale for diagnostic and treatment decisions, acknowledging any limitations or uncertainties. Question 17. System analysis indicates that a neuropsychologist is tasked with evaluating a patient referred for assessment of cognitive deficits following a traumatic brain injury, with a secondary referral question concerning the impact of these deficits on the patient's emotional and personality functioning. The neuropsychologist has limited time and resources for the assessment. Which of the following approaches best aligns with professional standards for assessing emotional and personality functioning in this context? Option A. Select a battery of neuropsychological tests that include specific measures of emotional regulation, mood, anxiety, and personality traits, supplemented by a structured clinical interview focusing on these domains, ensuring the chosen instruments have strong psychometric properties and are relevant to the referral question. Option B. Focus exclusively on the cognitive assessment and defer any evaluation of emotional and personality functioning to a clinical psychologist or psychiatrist, citing time constraints as a primary reason. Option C. Administer a broad-based personality inventory that covers a wide range of personality characteristics, assuming it will capture any relevant emotional or personality changes, and rely primarily on self-report data. Option D. Utilize a brief, easily administered questionnaire that screens for common emotional difficulties, prioritizing speed of administration over depth of assessment, and assume that any significant issues will be readily apparent. The correct answer is A. Select a battery of neuropsychological tests that include specific measures of emotional regulation, mood, anxiety, and personality traits, supplemented by a structured clinical interview focusing on these domains, ensuring the chosen instruments have strong psychometric properties and are relevant to the referral question. Explanation. This scenario presents a common implementation challenge in neuropsychological assessment, balancing the need for comprehensive emotional and personality functioning evaluation with the practical constraints of time and resources, while adhering to professional standards and ethical guidelines. The challenge lies in selecting assessment tools that are both valid and reliable for the specific referral question and client population, and in integrating the findings into a coherent and clinically useful report. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based selection of assessment instruments tailored to the referral question and client characteristics. This aligns with the ethical principles of competence and beneficence, ensuring that the assessment is appropriate and serves the client's best interests. Furthermore, it reflects a commitment to using psychometrically sound measures, which is a cornerstone of professional neuropsychological practice and implicitly supported by the standards of the American Board of Professional Neuropsychology. The integration of multiple data sources, interview, collateral information, and standardized tests is crucial for a holistic understanding, a requirement for thorough neuropsychological evaluation. An incorrect approach that relies solely on a single, broad-based personality inventory, without considering its specific relevance to the neuropsychological referral question, fails to meet the standard of appropriate assessment. This could lead to an incomplete or misleading picture of the client's functioning, potentially violating the principle of beneficence by not adequately addressing the referral question. It may also represent a failure of competence if the chosen instrument is not well suited for assessing the specific emotional and personality aspects relevant to neurological conditions. Another incorrect approach that involves administering a battery of tests without a clear rationale or linkage to the referral question, or without considering the client's capacity to engage with the testing, is inefficient and potentially harmful. This could lead to test fatigue, inaccurate data, and an unnecessarily burdensome assessment process for the client, violating the principle of non-maleficence. It also demonstrates a lack of systematic planning and adherence to best practices in test selection and administration. A third incorrect approach that prioritizes speed and ease of administration over the psychometric properties and clinical utility of the chosen instruments is ethically problematic. This approach risks generating unreliable or invalid data, which can lead to misdiagnosis and inappropriate treatment recommendations, directly contravening the principles of competence and beneficence. It also undermines the credibility of the neuropsychological assessment process. Professionals should employ a decision-making process that begins with a thorough understanding of the referral question and the client's history. This informs the selection of assessment methods, prioritizing those with established validity and reliability for the specific domains of interest, emotional and personality functioning in this case, and the client population. A systematic approach involves integrating data from multiple sources, including clinical interviews, behavioral observations, and standardized measures, to form a comprehensive and nuanced understanding of the individual's functioning. Ongoing self-reflection and consultation with colleagues are also vital for ensuring the quality and ethical integrity of the assessment process. Question 18. Strategic planning requires a neuropsychologist to develop a comprehensive understanding of a patient's cognitive and behavioral deficits. Given a patient presenting with significant executive dysfunction and memory impairments, and neuroimaging revealing a lesion in the prefrontal cortex with associated white matter tract disruption extending towards the hippocampus, what is the most appropriate next step in developing a targeted intervention plan? Option A. Systematically analyze how the prefrontal lesion and disrupted white matter tracts specifically contribute to the observed executive and memory deficits, and then design interventions targeting these identified neuroanatomical functional relationships. Option B. Broaden the differential diagnosis to include a wide range of potential neurological and psychiatric conditions, deferring specific intervention planning until a definitive etiological diagnosis is established, irrespective of the neuroimaging evidence. Option C. Focus primarily on the patient's subjective reports of memory difficulties and develop compensatory strategies without detailed consideration of the neuroanatomical findings. Option D. Recommend a series of unvalidated cognitive exercises that are generally associated with memory improvement, based on popular literature, without a direct link to the patient's specific neuroanatomical profile. The correct answer is A. Systematically analyze how the prefrontal lesion and disrupted white matter tracts specifically contribute to the observed executive and memory deficits, and then design interventions targeting these identified neuroanatomical functional relationships. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neuropsychologist to integrate complex neuroanatomical findings with a patient's subjective experience and functional deficits, all while adhering to the ethical and professional standards of the American Board of Professional Neuropsychology, AP. The challenge lies in moving beyond simple localization to a nuanced understanding of how distributed networks and specific lesion sites contribute to the observed neuropsychological profile, and how this informs treatment planning. The AP emphasis on evidence-based practice and ethical conduct necessitates a rigorous, systematic approach to diagnosis and intervention. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the AP commitment to evidence-based assessment and intervention. By systematically analyzing the neuroanatomical correlates of the patient's specific neuropsychological deficits, the neuropsychologist can develop a targeted and effective treatment plan. This involves understanding how damage to particular brain regions, G. Frontal lobes for executive functions, temporal lobes for memory, or disruptions in specific neural pathways, e.g., white matter tracts connecting different areas, manifest in observable cognitive and behavioral impairments. This approach is ethically sound as it prioritizes patient well-being by ensuring interventions are grounded in scientific understanding and tailored to the individual's neurobiological profile, thereby maximizing the likelihood of positive outcomes and minimizing the risk of ineffective or harmful treatments. It also reflects the APP standard of competence, which requires a deep understanding of neuroanatomy and its relationship to neuropsychological function. Incorrect approaches analysis, an approach that focuses solely on the patient's reported symptoms without correlating them to neuroanatomical findings, would be professionally unacceptable. This fails to meet the APP standard of comprehensive assessment, which mandates the integration of multiple data sources, including neuroimaging. Ethically, it risks misdiagnosis and inappropriate treatment, potentially leading to patient harm by not addressing the underlying neurobiological basis of the disorder. An approach that prioritizes a broad differential diagnosis without specific attention to the neuroanatomical evidence would also be problematic. While differential diagnosis is crucial, the APP emphasizes the importance of integrating all available data, including neuroimaging, refined diagnostic hypotheses. Ignoring or downplaying neuroanatomical findings would be a failure of due diligence and could lead to a diagnostic impasse or an incorrect conclusion, violating the ethical obligation to provide competent care. An approach that relies on anecdotal evidence or unvalidated treatment techniques, even if seemingly related to the symptoms, would be a significant ethical and professional failure. The APP expects practitioners to adhere to evidence-based practices without a clear link to established neuroanatomical correlates and validated interventions. Such an approach would be speculative and potentially harmful, failing to meet the standard of care and the ethical imperative to practice competently. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment, integrating all available data, including neuroimaging, patient history, and neuropsychological test results. This data should then be analyzed through the lens of established neuroanatomical cognitive relationships. The resulting hypotheses about the underlying neurobiological mechanisms of the patient's difficulties should guide the formulation of a differential diagnosis and the selection of evidence-based interventions. Continuous reevaluation of the patient's progress in relation to the neuroanatomical understanding and treatment plan is essential. This iterative process ensures that interventions remain relevant and effective, and that ethical obligations to the patient are consistently met. Question 19. System analysis indicates that a neuropsychological evaluation is requested for an individual presenting with progressive memory complaints and subtle changes in executive functioning, suspected to be early-stage Alzheimer's disease. The primary goal is to assess the current level of cognitive and functional impairment to inform prognosis and guide the development of a personalized support plan. Which of the following approaches best aligns with the APP and ethical guidelines and best practices for risk assessment in neurodegenerative conditions? Option A. Rely primarily on the diagnostic label of suspected Alzheimer's disease to predict the individual's future functional trajectory, using generalized information about disease progression without specific individual assessment. Option B. Focus the assessment on identifying novel biomarkers through advanced neuroimaging techniques, interpreting cognitive test results only in the context of these biological markers. Option C. Conduct a comprehensive neuropsychological assessment including standardized cognitive testing, structured interviews with the patient and a knowledgeable informant, and an evaluation of functional capacity in daily living, integrating all data to formulate a risk profile and actionable recommendations. Option D. Administer a brief screening battery of cognitive tests focusing on memory and attention, and extrapolate the risk of future decline based solely on normative data for the identified deficits. The correct answer is C. Conduct a comprehensive neuropsychological assessment including standardized cognitive testing, structured interviews with the patient and a knowledgeable informant, and an evaluation of functional capacity in daily living, integrating all data to formulate a risk profile and actionable recommendations. Explanation. This scenario is professionally challenging due to the inherent uncertainty in predicting the precise trajectory and impact of neurodegenerative diseases on an individual's cognitive and functional abilities. Neuropsychological assessment in this context requires a nuanced understanding of disease progression, individual variability, and the potential for both objective decline and subjective experience. The goal is not merely to diagnose, but to inform prognosis, guide treatment, and facilitate adaptive strategies, all while respecting patient autonomy and confidentiality. The correct approach represents best professional practice by prioritizing a comprehensive, multimodal assessment that integrates objective neuropsychological test data with collateral information and the individual's subjective experience. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are tailored to the individual's specific needs and risks. Furthermore, it adheres to the American Board of Professional Neuropsychology's (APPEN) guidelines for ethical practice, which emphasize thoroughness, accuracy, and client-centered care. The focus on functional implications and the development of a personalized management plan directly addresses the practical needs of individuals with neurodegenerative conditions and their families. An incorrect approach that relies solely on a limited battery of tests without considering collateral information or the individual's lived experience fails to capture the full spectrum of cognitive and functional impairment. This can lead to an incomplete or inaccurate risk assessment, potentially resulting in inappropriate recommendations or interventions. Ethically, this approach could violate the principle of fidelity by not providing the most accurate and comprehensive information possible. It may also fall short of the APPEN standards for comprehensive evaluation. Another incorrect approach that focuses exclusively on the diagnostic label without considering the individual's unique presentation and compensatory strategies overlooks the plasticity and resilience that can exist even in the face of neurodegeneration. This can lead to overly pessimistic prognoses and a failure to identify strengths that can be leveraged for support. Such an approach risks violating the principle of justice by not treating each individual equitably and with due consideration for their specific circumstances. A third incorrect approach that prioritizes a purely academic or research-oriented interpretation of test results, detached from the immediate clinical needs and functional implications for the individual, fails to meet the core purpose of neuropsychological assessment in this context. This can lead to recommendations that are not actionable or relevant to the patient's daily life, potentially causing distress and undermining the therapeutic relationship. This approach neglects the principle of respect for persons by not adequately addressing the individual's practical concerns and quality of life. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the referral question and available background information. 2. Select an assessment battery that is appropriate for the suspected neurodegenerative condition and the referral question, ensuring it covers key cognitive domains. 3. Administer tests under standardized conditions. 4. Integrate test results with collateral information e.g. from family members, caregivers, medical records, and the individual's self-report. 5. Interpret findings within the context of the individual's age, education, cultural background, and premorbid functioning. 6. Focus on the functional implications of cognitive deficits and strengths. 7. Develop a personalized risk assessment and management plan that is collaborative and client-centered. 8. Communicate findings and recommendations clearly and ethically, respecting confidentiality. Question 20. The efficiency study reveals that the neuropsychological assessment team is struggling to consistently generate comprehensive cognitive profiles that accurately reflect patient functioning across attention, memory, language, executive function, and visuospatial skills. Which of the following approaches best addresses this challenge, while adhering to the principles of professional neuropsychological practice as outlined by the American Board of Professional Neuropsychology? Option A. Encouraging team members to rely primarily on their clinical intuition and past experience to interpret cognitive test results, minimizing the need for extensive data cross-referencing. Option B. Developing a protocol that mandates a thorough review of all assessment data, including qualitative observations and performance patterns, to identify interdependencies between cognitive domains and to formulate an integrated interpretation of the individual's cognitive profile. Option C. Implementing a standardized scoring rubric for each cognitive domain and focusing on identifying the most significant deficit in each area to expedite report generation. Option D. Prioritizing the assessment of a limited number of cognitive domains that are most commonly associated with the referral question, thereby reducing the overall assessment time and interpretive burden. Correct answer is C. Implementing a standardized scoring rubric for each cognitive domain and focusing on identifying the most significant deficit in each area to expedite report generation. Explanation. The efficiency study reveals a significant bottleneck in the neuropsychological assessment process, specifically concerning the interpretation and integration of data across multiple cognitive domains. This scenario is professionally challenging because it requires a neuropsychologist to not only administer and score tests accurately, but also to synthesize complex information into a coherent and clinically meaningful profile, all while adhering to the stringent ethical and professional standards set forth by the American Board of Professional Neuropsychology, AP. The AP emphasizes the importance of comprehensive assessment, accurate interpretation, and the application of findings to clinical decision-making. The correct approach represents best professional practice because it prioritizes a systematic and integrative method for analyzing cognitive data. This involves carefully considering the interrelationships between different cognitive domains, accounting for potential confounding factors, e.g., effort, mood, sensory deficits, and grounding interpretations in established neuropsychological theory and empirical research. This approach ensures that the assessment is not merely a collection of scores, but a nuanced understanding of the individual's cognitive strengths and weaknesses, which is crucial for accurate diagnosis, treatment planning, and prognostication. Adherence to AP standards necessitates this level of rigor in data interpretation. Incorrect approaches fail to meet professional standards by either oversimplifying the interpretive process or by neglecting critical aspects of data synthesis. One incorrect approach might involve relying solely on normative data without considering individual variability or qualitative observations, leading to misinterpretations that do not reflect the individual's unique presentation. This violates the AP emphasis on individualized assessment and interpretation. Another incorrect approach could be to focus on a single cognitive domain in isolation, ignoring how deficits or intactness in one area might influence or be influenced by another. This fragmented approach fails to capture the complex interplay of cognitive functions and can lead to incomplete or inaccurate conclusions, contravening the AP requirement for comprehensive evaluation. A third incorrect approach might involve prematurely concluding the assessment based on initial findings without thoroughly exploring all relevant cognitive domains or considering alternative explanations for observed patterns. This haste can result in diagnostic errors and inappropriate recommendations, which is ethically and professionally unacceptable under AP guidelines. Professionals should employ a decision-making process that begins with a clear understanding of the referral question and the specific cognitive domains to be assessed. This is followed by careful test selection, administration, and scoring. The critical step, however, is the systematic integration of all gathered data, including test results, behavioral observations, and historical information. This integration should be guided by a theoretical framework and a critical evaluation of potential alternative explanations. Professionals must continuously ask themselves if their interpretations are supported by the data, if they have considered all relevant factors, and if their conclusions are clinically meaningful and actionable, always in alignment with AP standards.